Malaria is a huge problem. Between 750,000 to 1 million people die a year from malaria, and many of those are younger children and mothers. The economic cost is massive, $12 billion a year in GDP, a real impediment to economic growth. But the good news is that malaria numbers are coming down. We're finding interventions that are actually reducing death rates and providing economic opportunities that didn't exist before, improved livelihoods, better education environments, because we're able to really thwart much of the growth of malaria. And a part of that is because we found that the interventions in a combined fashion are very effective. Use of medicines, use of bed nets, use of indoor residual spraying with insecticides, as well as education campaigns have really helped bring down many of those numbers. And our project is an effort to try to reduce the impediments, the flow of those commodities to combat malaria.
Although everybody knows that malaria is transmitted by mosquitoes, it's actually a very complex disease to control, and you need to do what's called vector control, controlling the disease vector, the Anopheles mosquito, as well as diagnosis and treatment. And all of that means that there are a lot of commodities that are required to do that. We need bed nets for people to sleep under, insecticides to spray inside houses, as well as the compression spray pumps to apply the insecticides. And then of course there is diagnosis and treatment, and we need these new rapid diagnostic tests which can identify whether or not a person has malaria, and then the treatment, the malaria drugs. So it's a commodity heavy intervention. Thanks to advocacy and improved leadership from both the US and EU, as well as in country from malarial countries, that the volume of spending has gone up to over $2 billion in 2011. That's an enormous increase in spending, and concurrently means an enormous increase in the commodities that are being imported. So that's why with that volume of product, it's important to address these trade issues, particularly because few malarial countries in Africa produce the commodities. Almost all of the commodities are coming from India and China, as well as Vietnam and some other countries, and Europe. And so what we need to do is make sure that because there's such a huge volume in trade, we do whatever we can to remove any trade barriers, both the tariffs as well as the non-tariff barriers.
The issue, of course, is how to implement this program. And the first thing we want to do is to make sure that all the tariff categories are known around the world. And unfortunately, we have an organization at the World Customs Organization which has a system that most of the countries in the world use, over 200 countries now. And what we're trying to do is clarify the classifications. This will provide us with a way of monitoring the trade to determine the needs of the individual countries involved, and to help to plan next steps in terms of how to implement the programs. We have to deal with both the private sector and the governments, but the governments have to move first. They have to seek to make these goods more accessible, both in terms of cost and time. And in terms of cost, we want to reduce and eliminate all of the customs barriers, the tariffs primarily, and also to make the product accessible. That means entering the commerce from foreign countries. Most of these countries who are suffering from malaria do not produce these goods. And fighting the disease is heavily commodity dependent. So we have to get goods to these people, to the clinics and the hospitals and so forth, as soon as possible.